This presentation is on nursing burnout. The objectives of the presentation is to discuss a research question regarding nursing burnout, to review the literature found on the research topic of nursing burnout, and to speak about the method used to find the research, and also to summarize the research findings for simple practice application. Healthcare employees are in particularly susceptible to burnout. It is very high and common in the healthcare profession. That is according to Linden. And there's many different variables that may cause nursing burnout. Such variables could be high job demands, patient population, or workplace environment. The purpose of this presentation really is to explore what the results of the research found on staff nurse burnout were. So the PICO question is, in nurses who provide direct patient care, does hospitals with better staffing, higher wages, and good work environments, compared to hospitals with less staffing, lower wages, and poorer work environments, have better nurse outcomes? Nurse outcomes being like job satisfaction, burnout, intent to leave. So the literature search began by searching databases such as Medline, EBSCOhost, and Google Scholar. Keywords like burnout, nurse, and job satisfaction were used in narrowing the search, and data results were also limited to full PDF peer-reviewed articles that were published in the last 5 years. Originally, with these limitations, there was thousands of articles that were displayed, and then after the limitations were applied as far as peer-reviewed articles in the last 5 years and certain keywords like nursing burnout, job satisfaction, intent to leave. The results were limited to 760 articles. And the articles that were chosen specifically for this research were because of the diversity of the information that the literature concluded, and also because the research related to the PICO question asked. So finding the literature really wasn't that difficult at all. There was a lot of literature out on nursing burnout, but deciding on the articles and which ones to use was time consuming. It became easier as I began to understand more how to break down research articles and really look at the research the way that Hauser kind of explained during this course. So that became easier as time went on, but it still was very time consuming in just figuring out which articles would be adequate. So the literature synthesis. Nurses and job burnout were studied in all 5 of the articles that were used. However, each study was conducted in different countries. One was in Spain, and then South Korea, the United States, the Netherlands, and also Belgium. The diversity in these studies probably detracted from the potential for selection bias, and it also encapsulated information about several different cultures and populations, which is good. However, because of diversity, some groups during the study could be over underrepresented, and that is just what Hauser states about possible too much diversity in a population. However, each specific study, each specific article used nurses from that specific country. So it was a well representation of the population studied for that specific article. The research conducted in the South Korea article only studied new nurses, whereas all of the other articles simply studied all general nursing staff. Each of the articles addressed the concept of burnout to varying degrees and different variables that could be causing burnout, and all the research articles used some method of surveys to assess the population which were being studied. So that was a similarity between all of the articles. Every article also had a sample size of 350 people or greater. Most of the articles had a sample size of over 1,000 and even up into like 20,000. So the sample sizes for these articles were significant. According to Chang and Co., one of the articles that was read, 73% of newly licensed nurses experience workplace bullying, which decreases job satisfaction and increases burnout and also turnover. Wage was not found to largely impact burnout rate. However, poor work environments and poor staffing had a significant impact on job dissatisfaction and intent to leave the job. And employees were 30% less likely to leave their job if having a good work environment and adequate staffing. Just a statistic to support the previous comment. Another study that addressed stressful work environments due to heavy patient population. This study just addressed different treatments and assessment tools that could be implemented to help provide care for dementia patients, which is a heavy patient population. And once those tools were implemented, nursing burnout and job satisfaction was measured by the employees to see if that intervention helped. And the study revealed that job satisfaction increased by 5% when the staff were equipped with proper assessment tools to help treat the difficult environment. The difficult patient population. And one article also, interestingly enough, revealed that women are more prone to burnout than men. This could be regarding just emotional stamina. But each article had a very similar conclusion from every article was that burnout in general is just high in the nursing profession. There are many different variables that impact this, and you can see that by previous statements of just the fact that it could be because of your gender, or because of your working environment, or because of staffing issues, or because of a difficult patient population. So the practice recommendation is just that a positive work environment is necessary to decrease staff burnout. This may be difficult to adjust simply because it could involve changing policies in order to increase staffing, which could increase hospital budget or impact the hospital budget. It could also mean addressing such things as bullying, and that could be difficult to just address, knowing where to start or what the source of bullying is and how to really fix it. So the practice recommendation is ultimately for a more positive work environment, but because there's so many variables that can play into either a positive or a negative work environment, it would be a difficult recommendation to fully employ and implement. So in conclusion, burnout is very significant in the nursing profession, as stated before, and many variables play a part in causing burnout, making it a complex issue to address. There is a lot of research out there on the topic and why it happens, how to prevent it is also just complex and multifaceted. So here are the references for this presentation. Hope it was enjoyable.